So when we initially started looking for a franchise, healthcare side franchise, we looked at various options. The Kare Plus was the one who standard out with multiple income stream, not only domiciliary. So you started with the recruitment, build up your business, then jump to domiciliary. Whereas at that point in time, there was a lot of providers or franchisors who had only domiciliary or only that. So Kare Plus kind of gave both options.
I've enjoyed working with Golam. He understands how I work. He knows that I've got an eye for detail, and I won't let, I don't compromise when it comes to quality or standards. Without the quality, then your service is going to be poor. You have to have quite high standards, and that goes with everyone. So that's with me, the care coordinator, the care supervisor, staff. Everything's got to be at a high quality.
So there's a couple of things. Obviously, the hard work, and we had to work hard. Obviously, the franchisee was a model, but we need to believe in the model first thing. We need to have the right support. Obviously, this healthcare side, although it was in healthcare, it's quite different to what I did. Support was there, and then the drive. We had to drive ourselves. Then the model was good, and there was a lot of other factors such as where you can supply with the big national contracts, and we had to make sure we are recruiting at the level. We had to ensure that we are investing the right time in the domiciliary business. So it all kind of clicked in when you started following the model, and it sort of one led to another. So obviously when we started, we needed initial support of how to set up a business, what is healthcare business, to get trained and to understand the market. But slowly and gradually, when we grow ourselves, we needed different support. We needed BDM support to develop the business, to make sure we are a profitable business. We had got excellent people who helped us generate our sales. The first client, to be fair, was generated by Kare Plus BDM, the then BDM, who actually made our first client, through the door. So that was great. And then now we are at a stage where we need more strategical support, that we need how to expand your business, what are the new items or the new products we can bring into the market.
The person I deal with mainly was the head of domiciliary. He understands how I work. I always go to him for support when I need it or if I'm unsure. They're only on the other end of the phone, which is always good. Some of the other places I've worked for, when it's just you and a director, they don't always know all the answers, so it's nice having an extra bit of support.
We had a different level of support, startup business support, which we had a 5-day training of the franchise, which was all good to understand the market. Then when we came after the training, we had to implement it. We had a good 6-week plan. That week 1 you're expected to do this, week 2, week 3, and then end of that week we had to have our first client through the door. I remember Kare Plus helped us to get the first client through our door, which was a great help because we actually didn't know much about sales. Since then, the support in terms of how you recruit, what's the best way to recruit, even for finance, we got finance through Kare Plus referral to the bank, so that was great as well. Then we've built on, we've got one territory, second territory. Now we are in a level where we need more strategical support. We don't need the startup support, we need support to make sure we sustain the growth, make sure we are competitive, we are good competition in the market, make sure we are doing quality stuff, sending quality people to work, so we're still in a sustainable business. We've got 10-15 people working for us in the office. They need daily support, and they're free to speak to the head office in various things, compliance, badge upload or recruitment. So I think it's a very good mix of support that we've got and where we are now. I call it success. A little success is due to my dad, because he believed in me when I started in Kare Plus. Obviously we had to have some money invested in, and then we never had that much saving. He was the only person who believed in me, and he kind of lent me the money to start the Kare Plus. And then I had other 2 directors, was one of my very old school friend, and he kind of trusted in me as well. He said, what, if you're going for that. So kind of it all came to people who trusted on me to start a business. We knew there is a failure, you can fail, any business can fail. But I guess, the trust in me and I trusted other people as well, all kind of clicked together, and the credit goes to my dad believing in me. Do not be put off by you do not have any experience in healthcare. You don't need to. I mean, my experience, although healthcare was accounting, it's got nothing to do with what I do now. It's completely different, and I know a lot of other people come across from different areas and done this business successfully at Kare Plus. So I think it's the quick, multiple income stream what makes Kare Plus stand out. One of the best franchises you can consider at the moment in time They've got a proven model which worked for me and my business partners for 5 years. We have worked hard. We have got the reward for that. Support team at Kare Plus is great. They will ensure that you're heading the right direction. If you follow the model, you will be rewarded.